Thank you for honoring us by choosing to attend this international conference on disability in Krystle Kabare's memory. While working on a DFID research in Rwanda, Krystle Kabare told me that she was touched by the challenges that blind and visually impaired children were facing, and had expressed a desire to mobilize friends to purchase a braille machine for a school for the blind that she had visited. So in her memory, we are planning to establish a number of initiatives, one of which is today's dialogue on disability, an issue she passionately cared for. Ladies and gentlemen, the challenges faced by persons with disabilities in developing countries are many. According to Kenya National Bureau of Statistics data, children aged 6 to 17 years with a disability are much more likely to have never gone to school. That means 1 out of 6, compared to their peers without a disability, 1 out of 10. A child born in Nairobi, a child born with disability in Nairobi, or a child born with disability in rural areas is equally going to face more challenges than their peers who are not disabled. Despite these challenges, there are a number of successful disabled persons. I think some of us, their capacity to excel in spite of their disabilities inspires many of us. So it's an undisputable fact that when poverty conspires with disability, the outcome is the consignment of many persons with disabilities to lives of destitution, particularly in developing countries. Occasionally, our consciences are pricked by livid media stories of inhumane experiences that some persons with disabilities regularly face. I was personally touched by recent media stories of mentally ill persons who are caged by caregivers, the enslavement of disabled persons for monetary gains, and trafficking of persons with albinism to Tanzania to be sacrificed for macabre rituals by witch doctors. Persons with disabilities need concrete policies and solid solutions that are systematically implemented. We all know the 3 issues that were identified at independence, namely the eradication of diseases, elimination of ignorance, the fighting of poverty. I think the founders of this nation forgot to add disability to the list of priorities. I therefore hope that today's conference will seriously reflect on disability issues with the aim of building a disability-inclusive social protection system for Kenya and the region. In conclusion, I call on each one of you to join us in calling for establishment of a comprehensive child benefit scheme in Kenya. We want to ensure that every disabled child in Kenya is able to receive a regular cash benefit set at the level of the Inua Jamii Senior Citizens Pension. In other words, Kenya shillings 2,000 per month.
I think I met Krystle about 6 years ago, and immediately I recognized a kind of talent, but also a passion and enthusiasm. And it took me about 2 or 3 years to persuade her to join Development Pathways. But today I'd like to talk about disability and social protection. And really, as we say, it's a call to action. These graphs are sort of showing the prevalence levels of severe disability, not just disability, severe disability in Kenya. Around 3.5% of Kenyans have some form of severe disability. We don't have actually, unfortunately, this is one big issue, we don't have reliable data in Kenya to know quite how many people have some form of disability, but we certainly know that 12% of households have at least one member who has a severe disability. So it's a very, very significant issue causing many challenges for people. Now, as you can see on the graphs on prevalence, while the prevalence of disability increases significantly in old age, when we look at the relative numbers, it's actually children where we find the highest numbers of people with disabilities. And that's what we want to highlight. The priorities for today is that we need to really be addressing the needs of children with disabilities to give them a great start in life. There's about 420,000 children with severe disabilities in Kenya that need our support. Disability for children can be particularly problematic. We know in many countries in Africa and Kenya that a disabled child is often regarded as a curse. We did research for DFID on social protection disability, and we found it's very common for husbands to leave their wives when a disabled child is born. The wife is then left to take care, particularly of children with severe and complex disabilities. Here's some data that we've put together from the latest household survey in Kenya. Now, as I say, the disability data is not very reliable in Kenya. It underestimates the numbers. The questions aren't very good in the data set. They need to be improved. But even looking at that, we've shown here the sort of poverty rates across the life cycle from children age 0 on the left-hand side to older people on the right-hand side, age 70 and above. And the blue line are the poverty rates of people without disabilities. And the orange line are the poverty rates of people with severe disabilities and their household members. And you can see a significant difference. Poverty rate, if a household has a person with a disability, poverty rates are likely to be of 34% higher than households without a disability. But this actually really underestimates the real challenges that people face, because people with disabilities also face very significant extra costs. Costs of transport. If you have a wheelchair, you often have to take a taxi. You can't get public transport. If you're blind, you may need somebody to accompany you. You have medical costs, which are much higher than everybody else faces. What we need, as we see in many countries, and some countries are moving towards this, is a life cycle system of disability benefits. Benefits that support people with disabilities right across the life cycle. From children, a child disability benefit for all children, as well as additional support to get into school. At working age, for those people with disabilities, the few, not many who really can't work, we need a sort of pension so that they can actually get by because they can't work. But we also need what we call a personal independence payment. This is the disability benefit that allows people to get into work but compensates them for these additional costs that they face in terms of medical treatment, transport, etc. But that really helps unleash the full potential of people with disabilities. And of course, an old age pension for everybody, particularly when we all will suffer some form of disability at some point in our life. And of course, for all of those who having to take care of and support those people with very profound disabilities, then we need a caregiver's benefit. South Africa, they put in place for children a care dependency grant. Every child aged 0 to 17 who requires and receives permanent care and support, although they're living with their families, is able to receive a grant paid at the same level as the old age pension in South Africa. This reaches almost 1% of children in South Africa. We know there's still children in South Africa that have missed out. We've written a report about this in South Africa if anybody wants to go to our website and see it. And the cost is actually only 0.07% of GDP, a tiny amount to invest in the most vulnerable children in South Africa. Across low and middle income countries, disability benefits for adults, we find 32 countries that are investing in disability benefits across the world. In terms of the coverage that we see, some countries are doing very well, such as Mauritius, Georgia, South Africa, Uzbekistan, which are managing to reach around 3% of the working age population, having not full coverage of all the needs, but significant coverage of making a big difference in people's lives. But of these 32, many of them actually are investing very little still and reaching very few people. In terms of the level of investment that we see, some countries, as you can see here, again, from South Africa, Uzbekistan, Brazil, Mauritius, Georgia, are investing over 0.3% of GDP. So how's Kenya doing? The good news is, I think Kenya is leading in terms of East Africa, much of Africa above the very southern countries, in terms of having put in place the Inua Jamii Universal Senior Citizen Scheme. Now, every older person, every Kenyan, once they reach the age of 70, if they have a disability or not, will be able to access 2,000 shillings a month. The bad news is, other people with disabilities below 70, there really isn't the right level of investment. While there is a benefit for persons with severe disabilities, it's still only reaching just 52,000 people with disabilities, a tiny fraction of the real need, and really only people with very, very profound disabilities. Not many of those who still need this support. And I think much more needs to be done. What's the solution? Well, we think there's a solution. The work that we did previously with the ministry and with UNICEF and WFP showed that we could put in place a child disability benefit for all children with a severe disability in Kenya. Let's start with those with a severe disability at the same rate as the Inua Jamii pension at 2,000 per month. It would only cost 0.08% of GDP, similar to the costs in South Africa. And over 300,000 children, if it was put in place by 2020, would benefit from that. Transform the lives of these children and their families. And a disability benefit for everybody of working age, similarly, set at a similar level, would only cost 0.11% of GDP, reaching almost 450,000 adults with disabilities. up to the age of 70 when they can transition onto the Inua Jamii pension. That's over 700,000 people that we can put onto that benefit immediately if the government has the commitment at a relatively low level of investment. And remember the economic benefits that will come from this as well.
I work with the National Council for Persons with Disabilities, and I have been asked to tackle the challenges faced by persons with disabilities in Kenya. Now, the challenges that are related to inaccessibility, we find that in our public places, in our public transport, access to education, we know that we have a free primary education, for example, but is it really accessible to persons who have disabilities? It is so sad that especially children who have some conditions, for example, autism, cerebral palsy, they cannot just be enrolled into the regular schools. The Article 54 of the Constitution of Kenya provides that a person with any disability is entitled to be treated with dignity, respect, and to be addressed in a manner that is not demeaning. But here we are saying that we refer to persons with disabilities in names that are very, very demeaning. It further states that one is entitled to reasonable access to all places, public transport, and information. The National Council has a role to play in ensuring that persons with disabilities are enjoined, in socio-economic and political participation. We have a fund that is the National Development Fund for Persons with Disabilities. And in this fund, we have different programs. Number one, we have the assistive devices program. And we ensure that persons with disabilities are able to function in society.
Uganda recognizes that social protection is a very important tool for reducing poverty, inequality, and vulnerability. And as you all know, for people with disabilities, this is a major problem because the major cause of poverty is the inequality of opportunity. You don't choose where you're born, you don't choose what happens to you. And so if you have a disability, you're more likely to actually live in poverty, and you are so vulnerable to poverty. And so in June 2010, Cabinet approved a proposal to implement the program that I work for, the Uganda Expanding Social Protection Program, with the objective of actually evolving a national social protection system, including a policy. So in 2015, we developed a social protection policy as a tool to reduce vulnerability to poverty and strengthen the resilience of all Ugandans. We have a disability consciousness, an increased disability consciousness within the program. So people with disabilities or people who are old and frail, we've identified them and we directly deliver the services within their homes. We also are scoping, this is in progress, disability service providers in Uganda so that we can, refer people properly. We are examining the additional costs that people with disabilities in the program are facing and how that's impacting the effectiveness of our program. And the plan is that we'll develop communication products that will enable these people to actually access these kinds of services, such as the site savers services, but also the other service providers that we plan to will come out of our mapping exercise, and then we'll provide a report which will guide the development of a long-term strategy. The Ministry of Gender, Labour and Social Development and DFID agreed to a 2-year program of work to build a comprehensive understanding of disability in Uganda and to make sure that our social protection interventions can address those unique challenges of disability.
Very, very proud of the work we did, and the mark she left in Kenya is really going to shape the agenda of social protection for the next decade or more to come. And I'll start with the Honorable Maura. Honorable Maura, I know you are very passionate on social protection.
The Persons with Severe Disabilities Cash Transfer Program, really which we started way back in 2010, is a manifestation of what is possible in this country. We still have a lot of challenges because of confusion. People still think that you need to be just disabled for you to access this cash transfer. It's very clear that we need to invest in universal coverage so that we don't leave anyone behind. So I think I would want to commit myself that I will be a strong champion for universal child welfare social protection program going forward.
As UNICEF and on behalf of UNICEF, we are very grateful and we highly appreciate her contribution in all the work that we have done from investment plan, sector review, and all the work we're doing jointly. Because in Kenya, the specificity is that UNICEF and WFP have been working hand on hand. You know, you can't address an issue without knowing the deep causes of the problem. So that's why I wanted to start with sharing some statistics. And it is estimated that 3,013,000 school-age children with disability in Kenya. This is according to some estimation that we have done as UNICEF in 2016. I just picked this statistic. There are many more statistics around disability. And this also helps us to really, if you want to address this issue using social protection, it's good that we know how disability is in terms of prevalence, what are the types of disability that people are experiencing, so that we can know what is the right scheme of social protection.
We have a provision that was enacted globally in 2016, and that is the Charter on Inclusion of Persons with Disability in Humanitarian Action. I think this is an area that is of interest to all of us, given that we exist in a country that faces perennial droughts and other shocks, but therein, there are people who live with a disability. And what I want to stress in my brief remarks on how we should be taking this forward is the fact that often there are certain assumptions that are made that the existing social networks will take into consideration the people who live with disability. And we often do not make really concerted efforts to make sure that in our identification of the people who really need to receive assistance, we are very careful not to leave out people living with disabilities.
I suffered polio at 8 months of age. And so I walked on my fours for 8 years. And thereafter, my mother rehabilitated me at home. That's why I'm very much on creating awareness. Because thereafter, although she carried me, she had to carry me to school every morning and meet me in the evening. I still learned something, and I was able to work for some time. And after retirement, an early retirement, I engaged myself fully on creating disability awareness.
It is important for us as service providers of civil society actors and anyone in government that is here to be able to break down what we mean by disability inclusive, because we've talked a lot about inclusion. And it's also important to say that one way of creating awareness around disability is to see people with disabilities as just part of the human diversity. Because if we start from there, then we'll begin slowly to understand issues or the needs of people with disabilities.
If I come to bridging this gap between disability and social protection, we know that social protection is all those measures by government or even non-state actors which cushion people from vulnerability and risks. Someone in the morning talked about the health insurance. The statistics we have from the Kenya National Survey for Persons with Disabilities 2007, only 16% of people with disabilities are in employment.
We're very pleased to launch these reports. These were reports that Krystle herself had written, but we hadn't fully finalized them at the time of her untimely passing away. So we're very pleased to be able now that we managed to get them done into publishable form. One, I think, is a piece of work that was very close to our heart on looking at social protection and disability in Kenya. report that she wrote is linked to some research that we were doing with DFID, and there's a number of other reports from around the world and specific countries. So pleased to have this one that she put together. And I think the other report is a report that she did. I think David already mentioned that she was working on the Mbao pension scheme. There was a visit from Ugandans to Kenya to look at that, and Krystle wrote a short report about the pension scheme, which I think is very, very helpful and useful. So we're very pleased to be able to launch these two reports today, and we hope you'll be able to take copies and take away and share them around. You'll be able to find electronic copies on our website.